Blindness is supposed to be a social evil, but actually it is not. It is not only a problem for the family, the society, it is also a condition which has a lot of economical and financial problems for the family, for himself and for the society. So, the problem of blindness should be dealt with at all levels, at individual level, at social level and at national level. So for this, what is most important is a creation of awareness. World Sight Day is celebrated across the world to create awareness among people so that blindness can be eradicated. There are various causes of blindness and 80% of all blindness are either preventable or can be curable. There are about 39 million blinds across the world, out of which about 18 to 20 million are only in India. In addition to blindness, there are about 240 million people who are visually impaired, and again about 1/3 of them live in India. So that is more the reason why it is important for us to create awareness about blindness in India. Of the main causes of blindness, the most important cause is called cataract, followed by glaucoma, and then it is followed by various retinal conditions like diabetic retinopathy, age-related macular degeneration, and then it is followed by visual impairment due to refractive error. And surprisingly, all these 5 conditions are preventable or treatable. Let us consider cataract as the first cause of blindness. It accounts to about 60% of all blinds, and cataract invariably is a condition which is very easily treated, and vision and sight can be restored by a simple surgical procedure. Cataract can be caused by various reasons, but most importantly it is due to age-related process which is called senile cataract. It can also be due to various genetic disorders, it can be due to trauma, it can be due to other environmental hazards because of any malnutrition or deficiencies or infections in the mother when the child is in the womb. So almost all these conditions which leads to cataract have a good prognosis, and it is only when we do not treat cataract the person goes into blindness. The most surgical removal of cataract and implantation of intraocular lens is one of the most successful surgeries in ophthalmology, having a success rate of 99.7%. The complication rates or the chances of losing eyesight is only 0.5 in 1000 cases. So obviously we should be very much aware about cataract blindness, which is accounting to 65%, and in case of any person who is not seeing because of cataract should be encouraged to undergo surgery and restore his eyesight. There are various techniques of restoring eyesight in cataract surgery. The most commonly used technique is called small incision cataract surgery, where incision is made and the cataract is removed. After removing the cataract, the capsule of the cataract is polished and cleaned. A lens which is called an intraocular lens is implanted inside the capsule, and the eye heals to focus very clearly and patient can see and restore eyesight. The next most common treatment for cataract is called phacoemulsification, where instead of cutting and removing the cataract, a puncture is made and a phaco ultrasonic tip is introduced into the eye, and with the ultrasonic vibration the cataract is liquefied, it is sucked out, and a foldable lens is introduced into the eye through that small hole, and it is unfolded and placed inside the eye to focus. The most recent technology to remove cataract is called femto-assisted cataract surgery, where femtosecond laser is used to make the hole, cut the cataract into small pieces, and then the ultrasonic probe is introduced to remove the cataract. With the advantage of femto, the technology has perfected to give almost 100% results in almost all cases. Now let's look into the second most common cause of blindness. It is glaucoma. Glaucoma is a disease of the optic nerve where the person becomes blind, and the blindness due to glaucoma is permanent. So it is important for us to again diagnose glaucoma at an early stage where the blindness can be prevented, not treated. So in these cases, the patient has absolutely no symptoms. So the glaucoma has to be suspected by the doctor and diagnosis has to be made. That is why called as a silent thief of sight. There are two types of glaucoma. One is glaucoma that occurs in childhood and another is glaucoma in the adults. Again, in both it can be open angle glaucoma or a closed angle glaucoma. In open angle glaucoma, the symptoms are absolutely normal. There are no symptoms which can tell the person that he is developing glaucoma. It is only when glaucoma affects more than 70 to 80% of the nerve and the nerve stops functioning, the patient complains of reduction in the peripheral field of vision. So that is why glaucoma awareness is more important to be created. People above 40 years should have an annual checkup to find out if they have glaucoma. People who have a strong family history of glaucoma should also be inquiring with the doctors whether their eyes have glaucoma or not. People who have frequent change of glasses, especially reading glasses, and people who have pain in the eyes when they are exposed to sunlight after staying in a dark room for 2 to 3 hours also have high risk of developing glaucoma. So one must remember that glaucoma is a silent thief of eyesight. It has no symptoms, and only when the glaucoma has damaged the eye by 70-80%, the person comes to know. So early diagnosis is very, very essential. Glaucoma accounts to about 12% of all blindness across the world. It is easily treatable with medicine, and in very few cases where medicines do not control the loss of vision, surgical remedy can be looked into. The third common cause of blindness worldwide are causes due to retinal diseases. Most common being diabetic retinopathy. In diabetes, the retina blood vessels starts leaking and that causes swelling in the retina followed by bleeding, and the blindness in these cases are again irreversible. So it is important for us, for all the people who are diabetic, to have annual eye checkup so that before the blood vessels in the retina start bleeding, it can be prevented, and proper treatment should be given either by giving lasers or by giving various types of injections in the eye. The retinal blood vessels should be prevented from bleeding. The other reason in retina which can cause blindness is called age-related macular degeneration, ARMD, where the central vision is gradually hazy and people cannot read prints because of ARMD. Though the person doesn't become blind, but he is less productive, he cannot see things very clearly. ARMD is something which cannot be prevented, but if ARMD occurs, there are certain steps to be taken to prevent progression of the disease so that the vision can be retained for longer period. People who have ARMD should take antioxidants regularly. Antioxidants are richly present in various fruits and nuts, and in addition to that, antioxidants are also available as in the market. In addition to that, a regular eye checkup to find out whether ARMD is progressing is also essential, because as long as the ARMD is a dry type of ARMD, the visual impairment is minimal. When ARMD becomes a wet type of ARMD, visual impairment worsens and that leads to sudden loss of eyesight. Wet ARMD can be treated by giving injections in the eye, vascular endothelial growth factor. These are the injections which are given, and the blood which comes into the retina can be absorbed, and some amount of visual recovery is possible in wet ARMD. A very significant and important cause of visual impairment that is very commonly seen in the rural areas is visual impairment because of refractive error. That means people have refractive power, but they do not use glasses and their eyesight remains poor. So this is a very simple condition to be treated. Using spectacles or contact lenses restores their eyesight. The only problem is proper screening. So it is essential that all children attending school should be screened annually to find out if their eyesights are normal, and if the eyesight is found to be abnormal, then they should be referred to the nearby eye center for a refractive correction. It is mandatory that annual eye checkup should be done at various intervals depending on the age. The first eye checkup of a child should be done before the age of 6 months to find out any congenital defects. Then the second eye checkup should be done before the child attends the school. After the child attends the school, it should be annual till the child is about 20 years of age. Then from 20 years to 40 years, it can be once in 2 years. After 40 years, again the eye checkup should be once a year. And if the person has diabetes, blood pressure or any other systemic conditions which can deteriorate the eyesight, it should be at least once a year or more frequently depending on the condition. To conclude, I must say that World Sight Day is an initiative to create awareness amongst all of us so that burden of blindness is reduced. It is celebrated every year, the second Thursday of October, and it is our responsibility as eye doctors to promote awareness about blindness so that the burden of blindness is reduced. Thank you.